Our capstone project was increasing NICU nurses' knowledge on early start breastfeeding at the bedside, and our group members were Cameron Buckman, Ashley Huddleston, and Sierra Stepp, with presenting today Lydia Powell, Kennedy Ratcher, and Emily Yersky. Overall, the purpose of our education plan was to increase the knowledge of early start breastfeeding for the NICU nurses at UCMC and educate about the benefits and barriers of this. A presentation was given to address a potential knowledge gap in the UCMC NICU with the goal of improving nurses' knowledge about the benefits of early start breastfeeding initiation after an online educational intervention. The American Academy of Pediatrics and the World Health Organization agree that breast milk as the first supplemental boosts immunity and prevents the contraction of illnesses in newborns. Research finds a gap in the ability for NICUs to overcome barriers regarding breastfeeding initiatives for newborn infants at discharge as well. The Journal of Obstetric, Gynecologic, and Neonatal Nursing suggests that the most modifiable factor in early start breastfeeding initiatives is to improve the nurse's knowledge, as patient outcomes are mostly affected by the nurse's ability to educate their patients.
Listed here are some of the most common barriers to breastfeeding. These are often many of the biggest reasons that nurses fail to successfully promote early start breastfeeding. This slide gives an overview of our educational plan, including our audience, the purpose of our education, and the tools used to collect our data through pre and post survey. The objectives of this project was to assess for existing knowledge gaps, stress the importance of early start breastfeeding, and present our interventions for education on early start breastfeeding and assess for decreasing the knowledge gap post-intervention.
Research suggests that knowledge retention is elevated when tools are used to refer back to content needed. One of the tools we developed for this intervention is a linear flowchart, which we are striving for use in the lactation room to affix the content we provided in our session with everyday bedside education for the nurse. This pathway helps the nurse remain on task and recall some of the milestones a child must meet to progress towards early start breastfeeding successfully. A Badge Buddy is a quicker reference tool that we created to serve as a double check step for breastfeeding readiness and education with families of NICU infants. We acknowledge as a group that a card on a nurse's badge reel would be more realistic for effective nurse use rather than a full-size flowchart. We organize the breastfeeding pathway into phases with checkpoint milestones to help remain consistent with our intervention and the hospital's recommendations. Scores from our pretest survey revealed that NICU nurses felt they had moderate knowledge of the hospital's current breastfeeding initiatives. With 72.7% of people polled agreeing, a staggering 81.8% of nurses disclosed that they never utilized the NICU's current protocol for breastfeeding readiness, which is intended to be used with every baby working towards breastfeeding, which is seen here with the blue section identifying as never using and the red section as rarely utilizing the current protocol. The biggest impact we identified with our intervention between the pre-test and post-test surveys was an increase in knowledge of the breastfeeding pathway intended for this NICU and utilization of these principles by the patients in the NICU. This growth identifies that we have achieved our purpose of increasing the NICU nurses' knowledge of early start breastfeeding. We feel confident in agreeing that this intervention has improved the level of comfortably educated nurses who will be able to educate and empower families at the bedside to work towards NICU breastfeeding and help launch more infants towards better health outcomes. Upon reflection of our research, we have identified that some restraints to our intervention were having a small sample size and only being able to deliver our intervention via WebEx due to NICU COVID policies. In the future, we recommend that an intervention be used with NICU nurses to increase breastfeeding for preterm infants early in their NICU journey.
Thank you, and these are our group's references.